Assalamualaikum and good day to everyone. Welcome back. This is our third chapter together. So in this chapter, we will learn how to write referral letter. Okay. Okay. Again, this is the learning outcome for this entire module. What we want you to be able to is to get an exposure on what is the principles of good documentation. We want you to be able to see and identify the common errors, and we want you to be empowered by being able to perform basic documentation in clinical practice. For this topic specifically, what we want you to achieve is to be able to describe why we write referral letters, and we want you to be able to practice writing an effective referral letter at the end of this module. So why do we refer? There are many reasons. As stated, number one, you need to refer the patient for a specialized care. You are just a medical officer, for example, and you need to get an opinion from a surgeon, so you refer this patient to a surgical department. Okay, sometimes you are unsure, so you are from clinic kesihatan and you need to refer this patient to hospital because of diagnostic uncertainty. In some cases, certain hospital may not have the treatment available, so the patient has to be referred out. For example, not all hospital have chemotherapy, not all hospital have radiotherapy, so they have to be referred. Another example is for surgical intervention. You do not have an OT in your hospital, so you need to refer. Okay. Access to advanced technology, for example, from where I was working last time, I was in district hospital where CT scan is not available, so we have to send the patients 2 hours away, 2 hours go and 2 hours back, 4 hours in total, just to get a CT scan, just to confirm whether this patient has stroke or not. Okay, you want to refer patient for multidisciplinary care. This patient in the hospital, and you need to refer to cardio team, you need to refer to physio and other things, so you refer for multidisciplinary care. Some patient just referred because of they want to be closer to home. They have an accident in Kuala Lumpur, their family in Perlis, so the patient is requesting you for him to be transferred to Perlis so that he can get his support from his family members. And the other thing that we refer is because of continuity of care. This patient has been discharged, you want clinic kesihatan to follow him up, okay, for continuity of care. So in essence, there are 3 reasons why we refer cases. Basically, refer to above, step up care. You are in clinic kesihatan, you want to step up the management to tertiary hospitals. Same level care, you want to refer because of logistic reason, as I stated just now. Or step down care, the patient can be discharged, but you still want them to be followed up in clinic kesihatan, you step the patient down. Right, so why writing a referral is important? Because it's an essence of clear communication. Sometimes the patient has been admitted for many months, but we only receive a piece of paper and we have not enough information, so the follow-up process is very difficult, and we do not know what to observe the patient for. Okay, referral is also important for patient safety. Your referral have to be thorough and clear so that the other team can actually take over seamlessly. Okay, efficient care coordination, same as above. And most importantly, why you want to write proper referral is because you want to avoid rejection, which is quite often that happen. Okay, we will learn how to write referral letter. I'm sure most of you have seen a referral letter. Okay, so this is the template for our referral letter in Kementerian Kesihatan. So at the top, we have the letterhead. Okay, kepada siapa, medical officer or specialist, jabatan klinik kesihatan ataupun departments, the date, the time, the name of the patient, the age, his IC, her gender, and etc. So this is a column where you put your history and physical finding. This is a column for you to put your results of investigation. Fairly straightforward. Okay, then a column for you to put your diagnosis, a column for you to put the treatment that has been given. Okay, reasons for referral. Okay, you have to state why are you referring to this patient to them, the referring team. And then your signature and chop. All right. So this is the template for referral, but actually referral can be done also in a blank paper in your continuation sheet if the patient is inpatient. Okay. All right, so you just write your date and time, and then you just write something like this: cardio referral or renal referral, or the teams that is you are referring to, so that when they flip the pages they can actually see what is your referral. Okay, don't forget your sign and chop. Okay, let's have a look of a case of Mr. Ahmad. Initially, this patient was admitted for infected left lower limb, diabetic foot ulcer. He underwent wound debridement and is now on post-op day 3 with healing wound showing minimal slough, no pus, and some granulation tissue. He is febrile, eating well, and ready for discharge. The plan is to prescribe oral antibiotics, cefuroxime to be specific, and painkillers, which is paracetamol and celecoxib, for another 7 days. Okay, the specialists who are discharging this patient also wanted him to be followed at KK for daily normal saline dressing. Okay, write a referral letter for this patient. So let's see an example. Okay, so this is a referral letter written by a student. If you can see, the history is quite scanty. Okay, and then the result of investigation, he puts MRI, no bony changes of osteomyelitis, but this information is not available in the case summary. Diagnosis is correct. The treatment is wound debridement, which is correct, but remember the patient was discharged with antibiotic. This was not written. Reason for referral is wound dressing, but it's actually normal saline wound dressing. Okay, this is to avoid miscommunication. Alright, so you are referring to whom, to which department. Okay, so where is your salutation? You have to write, dear doctor, thank you for seeing this patient, for example. Okay, alright, so in the ward, the patient was treated with IV ampicillin and sulbactam and discharged with oral antibiotics, wound upon discharge. So this is something that you have to give. You have to give a clear picture to the receiving team. Upon discharge, how does the wound look like? Okay, so if the wound is healthy, so when they review the patient, when they do the wound inspection for dressing, they can see the wound is now very unhealthy looking. Okay, right, so write something like this: kindly do normal saline dressing. This patient will be reviewed by our team on what date, for example. Okay, so they will have a knowledge that this patient is being seen by your team in another few weeks time, for example, but in the meantime you want klinik kesihatan to do dressing for him. Right, so this is another example. Okay, he has a salutation, which is very good. Okay, the treatment was stated here, but the reason of referral is not clearly, and then there's no sign and chop. Okay, right, so you have to be thorough. So writing a referral letter is fairly simple and straightforward. This comes with practice, so my advice is for you to keep on looking on medical records. How do doctors refer? Some referral letters are 3/4 pages because the patient has been admitted in ICU and every information is very important. Okay, sometimes it's too tedious to write everything, so what I recommend is for you to photostat the blood results. Okay, and if you are, for example, if you are referring to ortho team for fracture, you have to refer with an x-ray attached. If you are referring to cardio team, you have to attach the ECG. Okay, so that you can actually they can actually review the ECG. It's quite pointless for you to send a patient to cardio team without an ECG. Right, do not forget your signature, your sign, your name, your MMC number, your title, and then your hospital. Okay, so you need to understand it's quite common for your referral to be rejected, especially when your information provided is incomplete. It's usually infuriates the doctors. Your referral is inappropriate. Yeah, for example, you want to rule out CT scan. You want to rule out appendicitis by doing CT scan. Okay, but you can actually do ultrasound first. Okay, so your referral to radiology team was rejected and you did not have a proper communication. Some hospital, they want you to call them in advance before you send the patient, so that if they have any questions, they can actually discuss with you over the phone, and they can actually better prepare when the patient arrive. Okay, so if you do not call the patient, the team receiving team beforehand, it is very likely that your referral will be rejected. Okay, so we are at the end for this chapter. Just to recap, we have learned that the roles of referral in clinical care. There is step up, same level, and step down care. And we want you to practice an effective referral letter. Okay, don't forget to go through the reading materials. Don't forget to complete the quiz at the conclusion chapter before you pass the module. Okay, thank you. If you have any questions, please feel free to text me or email me. Thank you.